Hi, my name is RLopez, and I will demonstrate the use of narrative pedagogy as a teaching strategy. We have 4 nurses from an ambulatory care setting as participants in this teaching session. The participants have a list of topics they will choose from. The objective is to engage students in sharing stories and promote discussion. The students will be able to provide individual points of view on the chosen topic. So let's go ahead and get started. Each participant has a list of topics. We'll go ahead and choose a topic and start the discussion.
I would like to speak about the teaching with the licensed nurses as well as the nurses' aides in the ambulatory care setting, getting them to try to work together in a more productive manner to get them to work for us, not against us. That way it's more productivity on the floor and get things pretty much headed in the right direction, keep it smooth throughout the day.
Do you have any examples for teaching?
Sure, Ms. Lopez, I do. I have a particular I try to get the nurses' aides to understand their scope of practice and understand what the nursing scope of practice is. And if, for instance, if a doctor needs an EKG done and the nurses are busy with an injection, trying to make let them know that there should be their first priority to get those done if we're busy in that setting. So we had a little example of that the other day.
Good example. Does anyone have any other feedback regarding trying to get the LVNs to get injections done in a timely manner?
The way you approach them, if you go to them to where, you let them know that, hey, everybody, we can all work together and do this, but sometimes you have to delegate and be able to take responsibility.
Good, very good.
That's true. Make them feel included.
Right.
Because if you make them feel like you're in charge, then they don't want to do it.
Because a lot of them have been here a lot longer than we have. The PCTs, they get in their way of doing things, and they have someone else telling them, asking them. It's all about the verbiage, the way you ask them to do it, and to get them to do it for you, work with you.
Now, Ms. Paula, you mentioned approach. Do you feel like something else besides approach can help them to be able to understand where we're coming from as RNs?
You can go into the way you communicate with them, or sometimes your body language. Sometimes you don't have to necessarily say with your voice. Sometimes it could just be the way you come in, and some people take offense to that, and so they get into defensive mode, and then from that moment on, that's it. It's no turning back. You have to kind of try to de-escalate it and take yourself out of it and put yourself back in, just try to get back on one accord.
Good example.
Sometimes you have to set them aside as well,
Right.
because they feel embarrassed if you're you're not getting on to them, but you're telling them, hey, can you help me with this? They
Right.
feel like they're embarrassed if someone else is watching them, but you're getting on to them, and they don't want that. So setting them aside.
I think it's also very important that we play and perform as models for them, set good examples of what to do and what not to do.
Especially in situations,
yes.
the way we approach situations. Good
We
examples.
do have a lot of physicians that want those things done right away, and they have their way of kind of putting the pressure on us to get it done, and we need to be able to work well under pressure so that they, in turn, work well.
Right. So one thing we did learn from this discussion is the communication is a big issue. Make sure we communicate effectively and clearly, and of course, it's our approach, the way we approach them. If we approach them positive, in a good manner, we'll have a higher chance of them responding in a positive way as well. Okay, very good. You want to go ahead and choose another topic so we can go ahead and start the discussion again?
I probably would choose communication with the conflicts that you encounter. Like I said, one time I had a conflict where I've had 2 nurses that were in a disagreement, and I had to go to them and to try to de-escalate the problem before it got out of control. And so what I try to teach them is sometimes it's not always about talking. You have to listen, and then you can go from that point and say, okay, you listen to what they say, you listen to what the other one has to say before you just be, at each other's neck and everything about everything. So I think that would be a good thing to do, is to, even with communication with that, is to learn how to talk and listen, more than talking all the time.
Do you have an example of recently of conflict between nurse, physicians, about a patient?
No, just like I said, with the 2 nurses that were in a disagreement over an appointment, and all they had to do once you listen to the problem itself, it was really no problem. It was just one wanted to do it one way, and all they had to do was just listen, and it would have been done, and with no problems.
I have a good example of one. I have a nurse that was working with another nurse on a pod, and they both were working on the same discharge. And one of them looked over and saw, oh, you're working on that patient, and the other one looked over at an opposite time and saw so they both left it alone. So the patient's sitting there waiting, comes up to the desk, and then both of them were, oh, well, I thought you were, no, I thought you were. And they did it right in front of the patient. So pull them aside, talk to them about that. You don't do things like that in front of patients. And also, get it done and talk about it later.
Mhm.
You don't need to argue it out right there. You need to stop what you're doing, take care of that patient, and then discuss what happened later on.
Yeah, it's very important because there have been situations where either a PCT or a nurse has disagreed with suggestion, and instead of bringing it privately away from the patient, it's brought out right then and there, and that's not the place. And again, that's an example of being professional. You don't exhibit your dirty laundry in front.
Especially in an open environment like this, because
Mhm.
patients do nothing but watch you all the time, and they're able to see you all the time. So they do pay attention, and even when you think they, are not understanding or not paying attention, they watch everything, and they know how to report it, so.
Mhm. Mhm. Very good examples. And that is very important, like Ms. Lourdes did mention, is to make sure that whatever we're dealing with is to get it out of the way, get the patient going, take care of the patient, because patients do come first, and then go ahead and handle whatever situation. And again, it goes back to our approach and communication as leaders is for us to be able to approach them again in a positive manner, like Ms. Carla mentioned earlier, not to make them feel bad in any sense, but we're teaching them. We're
Right.
here to help them get through the process, and maybe the next time they'll think about it, wait a minute, maybe I need to take care of this patient and then go talk to my charge. I feel we had an issue, what can we do for the next time? So very good. So does anyone else want to go ahead and choose the topic?
I was looking at facilitation of patient care with limited resources. Sometimes clients come into the triage area and you don't have the resources, meaning you don't have the appointments. You don't have, so it's like, what do you do with this client? You're looking at them, you want to help them, but no appointments. Maybe the next available is, let's say, a month away, and the client needs to be seen hopefully today or maybe in the next 2-3 days. But it's like, sometimes you feel like, well,
Appointments.
where are these appointments that we need?
So I like that chosen topic because that is, as a public health system, we have that issue pretty much on a daily basis. We're limited on resources, limited on appointments. So let's do a roundtable. I want everyone to give me an example of what you did to try to help that patient, whether it's OB screening, your HIV patients. What did you do to go above and beyond so everyone else can be able to learn from your experience to get these patients in through our heart system?
Well, number one, sometimes I feel like I have to go beg for an appointment from the doctors, because I'll look at who's attending, and some of the attending are not very helpful, because they'll say, well, I'm not supposed to see patients because I'm attending, and I'm thinking, this is why we're here. And so sometimes I'll just end up going from doctor to doctor to find them a doctor that will see them so I can schedule them an appointment.
That's a good example. What does everyone else do in that situation?
Before I go see the doctor and see if we can. So sometimes even just going to your fellow coworkers, sometimes it's things that they know that it can help to move things on.
Okay. That's good.
And especially when doctors are not wanting to see a lot of patients, you can explain to them the problem, and sometimes they just want to know. If they don't know enough of what's going on with the patient, they can't really see it from our side and just accept them and have them been seen on the same day. And some will understand and they will see them.
Okay.
If you look at it also from the provider side, some of them are seeing 16 patients within a matter of 5 hours. One extra is like, just tipping the iceberg right there. So I think that also I sometimes, if the doctors won't, see if we can overbook for another day, or even if they want to go to another clinic, sometimes Acres or the nearest clinic they can go
It's a
to.
good idea.
That's true,
Overbooking
because I work
acres.
with my doctors, whenever I need somebody to be seen, what I do is work with their schedules. I look at their patients, and if it's someone that I know doesn't have like the pre-clinic labs, or is doing very well, can be rescheduled to another day, I go ahead and cut it down so where it's not so heavy on doctor and the patient gets seen. So-
Wonderful. Well, everyone's provided very good ideas. This has been a great discussion. We've gone over 3 topics, so I want to say thank you so much for your participation, and hopefully you learned some information today to be able to help you with patient care. So thank you.